It's great to welcome to the program today from my undergraduate alma mater, Dr. Peg Riley, professor at UMass-Amherst, who runs an undergraduate research lab focused on the discovery and preclinical testing of novel antimicrobials. Great to have you on. I appreciate your time.
My pleasure.
So, okay, maybe just to get into this, and eventually we're going to kind of relate this to the COVID virus and the suggestion of things like ivermectin or azithromycin for possible treatment or mitigation. When we think about antibiotics to treat illness generally, what are the sort of issues that we worry about coming up, including antibiotic resistance at a population level and other things?
Sure. Well, as most of your viewers will know, we use antibiotics in medicine to either prevent or eliminate an infection by bacteria. So they're very powerful, fantastic. They developed the name magic bullet for a good reason. They'll wipe out a staph infection or what have you rapidly. Now, when we first started using those in the 1950s, we didn't understand that we live with a microbiome. And that means we have bacteria and other microbes in us, on us, around us, and they're making us healthy, by and large. But antibiotics don't know the difference between what's a healthy microbe in our microbiome and what's the pathogen we want it to kill. So when you take an antibiotic for a strep throat or an ear infection or something much more serious, you stand the chance of really wiping out a lot of the good bacteria in your gut, the lactobacilli, the bifidobacter, all those things that you hear about in kimchi and yogurt. Well, all of those can be decimated as well. And so when we take antibiotics when we shouldn't, which is actually quite often, we could potentially make our health worse rather than better.
When we think about the long term of antibiotic use, if my research is correct, there's only a few types of antibiotics. Even though there's many specific ones, there's really only a few families. Is the path forward that eventually some new type of antibiotic medication will be necessary?
Well, I sure hope so, David, or we're not going to survive long.
Mm.
We are now in what we call the post-antibiotic era. And that was designated by the World Health Organization about 7 years ago now, where we have used, abused, and overused antibiotics to the point where we have pathogens that can cause fatal disease in humans that no longer respond to antibiotics. And I want to throw in one other sideline here, which we often don't think about. In point of fact, 80% of our antibiotics are not used for human health. They're used by the agricultural systems to either produce fatter, healthier pigs, or to keep blight off of apples or tomatoes. And so we're basically using these critical drugs designed for humans originally to make food cheaper. And that's something that society has to talk about and decide if that's a good route to be taking.
When we talk about the types of antimicrobials that you work on and look at developing, what's different about those versus antibiotics?
Great question. So with an antibiotic, it is chosen by a pharmaceutical company because it kills as much as possible. In other words, as many bacterial species as is possible. And the reason is the cost of developing and getting through clinical trials an antibiotic. It's several $billions. Now, picture that I have urinary tract infection and I want to take a drug to treat it. That's almost always caused by E. coli, which is a species of bacteria in your gut, in my gut, normally doesn't bother us. In fact, we're happy to have it for lots of reasons. But when it gets into our urinary tract system, it causes problems for some people. So imagine that I could give you a pill that didn't kill everything in your microbiome, but just killed E. coli. Now, picture that world. Now my microbiome is happy. I've killed the E. coli, and the selection for what you mentioned earlier, antibiotic resistance, is much lower. So when I take a conventional antibiotic, any bacterium in my body that can have a mutation that will cause it to be able to resist that drug, to fight it off, will be selected for, and they'll increase in frequency in my body. And that's what's happened over the last 50 years. That's why we have multi-drug or totally drug-resistant pathogens to deal with.
So let's maybe now introduce the topic of COVID-19. We've seen the suggestions, and some of these things have been studied, that azithromycin, known as Zithromax or a Z-Pak, even though it's an antibiotic and COVID-19 is a virus, that in some situations it can have an antiviral property, and maybe it should be used for treating COVID-19. The placebo-controlled studies I've seen don't seem to show that it actually does work in that way, but it is something that's being studied. Antiparasitic ivermectin, hydroxychloroquine, etc. What are there properties to some of these that could work, at least theoretically, when you're dealing with a virus?
Well, what they might do is impact something in your body that then helps you weather COVID better.
Mm.
Does that make sense?
Yeah.
Because these drugs are not designed to kill a virus. It's in fact very challenging for us to come up with medications that will kill viruses. And that's why we don't have a lot of them. It's not that we haven't tried. Heaven forbid, we've actually tried very hard. Now, a drug to kill a protist, a drug to kill a bacterium could impact you because maybe you have an underlying condition that is caused by a bacterium or a protist. And that when you get COVID, it exasperates either the COVID or exasperates the underlying condition. And so possibly that's why some people report feeling better when they take ivermectin, for example. Now, personally, I'm a scientist. I believe in data. And until the FDA tells me, or shows me better yet, the clinical trials, that means double-blind, placebo-based trials. And for those who don't know what that means the doc who's administering the trial has no idea which patient got which. They cannot bias their interpretation of a patient's status of health because they don't know who got the sugar pill. And that's the gold standard, and that's why it takes so long to get drugs approved by FDA. Those are tough studies to carry out, especially during a pandemic.
When we think about the way in which sometimes one medication or a few over time, like at one point it was hydroxychloroquine, azithromycin plus zinc, with or without zinc, ivermectin, etc. When we think about these things entering the kind of media discussion and becoming popularized, sometimes on one political side or sometimes more broadly, what do you think underlies this? Is it that when there's cheap, widely available medications around and no clear treatment, doctors say, let's throw something at it and just kind of see what happens? Is that the genesis of a lot of these things?
You know, I've never spoken to a medical doctor who would have used any of those
Oh,
alternatives. So I can't respond directly. What I can tell you is if we compare this to vaccine hesitancy, for example, and I teach classes of 400 undergraduates, none of whom are science majors, and many of them start out in my class agreeing that they are hesitant about getting vaccinated, and it came from their parents or from their neighborhood or what have you. And it's really an anxiety because you don't understand the science. And we scientists haven't taken the time to find ways to help you understand the science. So I blame the scientists, not the anti-vaxxers, if you will.
do
I
you?
think we do
Yeah.
a better job.
What tends to work in the classes at changing the perspective on vaccination?
I show them the history of the success of vaccines. I show them how a clinical trial is designed, how it's interpreted, what are the issues that one has to confront when interpreting the data. So without diving into the details, I give them the sense of how rigorous science, particularly science that is being used to impact human health, is carried out under, and the incredible role the FDA plays in being the gatekeeper. Because there are a lot of scientists that are so excited about their ideas. I mean, my drugs, I would love to give them to my neighbors right now. I would love to, but none of them are FDA approved, so I can't.
Right.
And you can't help but be excited about your drug or your idea, and that could be tempting in a time where there's a pandemic, where individuals are dying. If there's something, why not try it? That's the sort of attitude. Maybe that accounts for why medical professionals would do this, but I urge them to stop.
When it comes to the big picture impact of this period of time during which people are maybe washing their hands more frequently, wearing masks, not being around people as much, one fear that some have expressed is this may attenuate the strength of one's immune system merely by stopping a lot of these little interactions with different sorts of pathogens that you interact with all the time and you sort of build resistance to, so that you may come out of the pandemic not having gotten COVID, but maybe generally less protected from an immunity standpoint against things we encounter on a regular basis. Is there something to that? How long would one have to be, isolated from pathogens? And the other question is, if you're still eating food from grocery stores and going to the gas station occasionally, are you even really fully isolated from pathogens anyway?
Thank you. That's a great question and a great point you made at the end. So first of all, one of the greatest impacts on this new approach to life we're in, masking, isolation, separation, 6 feet or more, is going to be found in the nursing homes. And it already is being found in the nursing homes. Their microbiomes are far less diverse on average than an individual who may be just isolated in their home with family members. So we know that. And less diverse microbiomes in general are not as what we would call healthy. They're not as able to stimulate our immune system, just as you were talking about a moment ago. But we don't live in vacuums and we don't live in sterile chambers. And so going for a walk, getting a little dirt on your hands, believe it or not, eating the kinds of foods you were talking about, apples and high fiber, fiber-rich diets, are going to stimulate the good microbes that are already possibly present in your gut and get you back into the realm you want to be. So certainly eating fermented foods is always a good idea. That helps get the microbes enriched in your body that are so protective, like lactobacilli or bifidobacter.
So for the average person who had a year and a half of less socializing and wearing a mask when out, for example, is that really going to impact their immune system in a significant way?
I don't have the data to answer that question, but I can tell you from a sort of practical perspective, good as masks are, that does not keep any of us from using our hands to touch things.
Right.
And it does not keep any of us from walking inside and touching our face or our arm or what have you. So again, we're not living in a sterile environment. We're limiting the spread of things that carry easily in the air. That's what we're doing. And that's why flu essentially evaporated last year.
Right.
And in fact, I went back and watched an old lecture that I gave to my kids in this big class of non-scientists. And I remember right at the beginning of the COVID pandemic, before it was a pandemic, they were still in the class with me, 400 of them in an auditorium. And I said, guys, I'm going to let you go today because we're getting signs that this is highly infectious. But there's good news on the horizon. I said, you won't get flu this year.
Right.
And they just laughed as they were happy to leave the lecture room.
And it turned out to be quite accurate, in fact.
Oh, yes. I
Yeah.
mean, it was easy to predict. I mean, you wear masks, you don't touch each other. Gee, I wonder what'll happen with flu.
Right. Right. Yeah, that'll be interesting to see this flu season that's coming right now. Dr. Peg Riley, professor at UMass-Amherst, really appreciate your time and your insights today.
Thank you very much for inviting me to join you.